Say, we do have a very diverse population, so when you come into our, into our waiting area, it can be daunting because there's a lot of different people of, different walks of life who are there, and, so it can be comfortable, it may be uncomfortable for some people, it may be more comfortable for other people. It's interesting.
Well, it's reflected in your staff as well, which is, I think, overall a good thing.
Mm-hmm. Well, I do think it's a good thing, but I'm just saying.
But you're right. There is a...
Right. You have to be tolerant to come
That's right.
here as well, as a patient as well. I think that's important.
I'm only confused recently by Concierge Services.
Oh.
How does that dovetail with HMO, PPO?
The opposite.
So Concierge Services,
The opposite.
You pay
It's the
a
opposite.
certain amount of money, and you have, it's like when you go to Disneyland and you have a fast
Yeah.
pass.
You
That's
get
right.
put to the
So
front of the
Concierge Service, you pay a certain amount of money. I know practices that you have to pay $1,200. I know practices that you may pay $120 a year. And that's your membership, as it were, and then you have access to the physicians. I mean, depending how much the money is and who the physician is, that means you can call them, and you are guaranteed, as many visits as you need in a year. Call them morning, noon, and night, what have you. I think it might be a good practice for somebody who's needy of that kind of thing. But yeah. I mean, it cuts out the insurance negotiation in some ways. Actually, there are practices downtown that are using it very effectively that take the HMO insurances, and they're doing really well.
They do both. You're an HMO.
They have a concierge program. They pay $120. One medical is one of them, $120 a year, and they take HMO insurance. So you pay $120, and then
Just let
you're
down
both.
your HMO insurance.
They're just here from San Francisco, and they're
What
picking
was
up
it?
quick.
Care One?
One medical.
One medical.
Oh, so you pay administrative fee of $120, but you have to have.
Right, you
but
still
you're
keep your
still
premium.
You still have your insurance.
Yeah.
Oh, yeah.
You still have
They're
insurance.
just dealing with all of the.
You just pay an extra fee on top of
Right,
your
right.
insurance for
Well-
the internet
Like the
access
patient
and
portal.
next day appointments
Yes.
and
Okay,
that kind of stuff.
I see.
Billing issues.
I mean, my doctor's office charges an administrative fee of $35 to $45 a year, but it's voluntary supposedly, because they feel like they can't compete in a family practice. And so it is interesting but they take insurance, but they
Right.
still they need an administrative
Does the
fee.
concierge take insurance?
But this one,
Some
not
do,
all of
some
them.
don't. Yeah, some do, some don't. Depends.
Some concierge you pay $3,000 a year, and then you pay out of pocket for your test. But they don't bill insurances. There's a lot of doctors who don't bill insurances, and you just pay out of pocket for any visit.
Well, the insurance discussion may be something you want to save
Yeah.
for another night. And we may need to wait on the Supreme Court to decide what and how it's
to navigate those waters.
Absolutely complicated. Denise?
So I was curious because when Whitman-Walker was switching over to being a more community health center, one of the things that they had was patient advocates, which, as you mentioned, sometimes people might feel uncomfortable about something that happened, or they're not advocating for themselves. Is that still a program that exists here? And I just wanted to hear a little bit more about that. I'll just act as a...
We still have the transgender patient advocate because that was probably the largest amount of complaints that we got. So, and again, it's such a marginalized population, you really want to make sure that they feel comfortable talking to people. We have a program that's a little different, but it's more of a focus for HIV positive women in wards 5 through 8, which I know sounds so specific, but again, we get a lot of, it's kind of the same thing, a lot of the complaints. So she works out of Max, and she more focuses on both the complaints and also women who are out of care, and they get out of care, and then it's kind of what happened, and she's trying to bring them in. She comes to UT as well as Elizabeth Taylor, and we have our other Max Robinson Center in Southeast, but it's the same idea. After we really instituted the patient advocates, we got a more robust quality department. So the nice thing about our quality improvement department is there's a direct access to someone to make these complaints, and any complaint that's made gets put in writing and is sent to, if there's a person the complaint is about, plus their supervisor, and it's not in a tattletale way, but it's in a, you know, let's kind of figure this out, and then it's addressed back to the client. And then we've also instituted like a lot more anonymous complaint boxes, phone numbers, email address, and things like that that you can complain to. And I've also found I'm in community health, our community health department, and we just, because of what we do and where we go, get a lot of that. You know, so my whole team, because when you're out in the community, you don't tend to get all the complaints inside. Right. Because people don't walk into Whitman-Walker and complain. You get it when you're out there. And then so we do the same thing. We talk to people about that. And it was, you know, when we switched to a community health center, there were a lot of complaints because people didn't really understand what that meant. And you're not a free clinic anymore. Can I still go there? And do you still care about lesbians? Do you still care about gay people? Do you still care about HIV? And so that's kind of also something that we've been working on.
And those questions are still there.
They still are.
Still there.
And we are still trying to work on it. You're right. It's going to take us a while to get where people understand what we're doing.
One of the things that comes up all the time, I have done numerous support groups here, and when we switched over from the LSP space, which was like heaven, to like over here, one of the things that Dawn asked the women's community, and we had conversations like this, actually there was a lot more people, because if you get people rallied against something, everyone comes. Maybe you needed to put something out there a little more negative to get people to rise to the occasion, but that seems to be what brings people together. So the biggest question was, how will all of those services be translated, and how will they be communicated to the women at large? And I think that question is still, you know, I still pose that as someone on the panel. I would say
it's always been an issue, though, because I think ever since Whitman-Walker was in existence, and I have to say there's times when I felt that as a woman, we always got the crumbs. And I sometimes still always feel that way, and I always feel, and I even feel that now a little bit, that with all the assault on feminism, from Susan G. Komen to Planned Parenthood, and the assault on Planned Parenthood, you know, that that feminism is a little dead. And, you know, and that as women, we, you know, need to assert our power again.
It has to do with representation, too. I think one of the main things was the coming out groups and the starting over groups. And women really do flock a lot to, we talk to each other about everything. So that's still a need. And I don't know if that's a need that is served best here at Whitman-Walker or where it's served. But when women come in, they walk, I was just mentioning this, they actually have to walk through the front area to come in here. And it's intimidating to women to do that, and especially if you're coming out. For the coming out group, it's even more intimidating. So those things are still things that I think women have to address as a feminist hard and keep saying it until it's heard, I guess. And I think that's what these forums are good for.
I also feel like it's a lot more difficult now to address those needs and to be, you know, what everyone wants you to be, because I feel like now, especially like in the queer community at large, there are so many co-cultures. So I get a lot of calls from people looking for the most specific things. It's like, I need, you know, a therapist that is lesbian friendly and of color. They want these very specific things, so they want their community and their space and all of their things to reflect them. And I think that's something that's happening a lot more, especially here in DC.
Good.
There's a large, and I feel like feminism is very much alive in that way, because people are like, no, I want, you know, a lesbian community of color. I want to be around, you know,
people like me.
Right, I want to be around people like me. It's like, where are all the Jewish bisexual women? Like, where are they? I need to hang out with them. And I think that's kind of where Whitman-Walker and, you know, Montner Project and organizations that are working for the LGBT community get kind of the short end of the stick, because we have, you know, a perception. People think we are one thing, which we may not be. And so they just discount us for that.
One of the things that you're doing that we aren't doing, and is you address smoking.
Yes.
Yeah.
And I really commend you for the smoking initiatives that you've had. It's difficult.
It's difficult. It's difficult.
How is it difficult?
It's difficult because we, just like with this wonderful event, we put all of this time, effort, and money into advertising and doing outreach in the community. And, you know, people are like, yeah, this is great. We love that you're doing it. You know, we set the first meeting. We run a smoking cessation group. So it's kind of part educational, part support. And we kind of give people the tools and help them quit, and we all quit together. So, you know, we did one session this year, or rather 2011, where the first night we had 10 people. I mean, both gay and lesbian, you know, men and women. And they were like, this is wonderful. You know, we all got along really great. Everyone was really excited about quitting. The next week, oh, it's raining, so I don't really know if I'm gonna make it. Okay, so the next week we have 5.
Reflective is cigarette smoking and quitting smoking.
Right, exactly.
Yeah.
And so it's just difficult. It's like how, and with any, you know, topic, you know, positive health behavior change, how do we, like, what is it? Like, what is that, you know, switch?
That's even probably bigger than just the gay and lesbian community.
Right, it is bigger than the gay, and that's definitely one thing that we talk about in the group. And you know, the biggest thing is, well, you know, I'm going out tonight, or you know, I do a lot of this. I do one major excuse for people in our group where I do a lot of travel.
And that's why they can't attend the meeting, the next meeting. That's why they
I mean,
can't
yeah, that's why they can't attend the next meeting, and that's why they're having trouble smoking. I mean, quitting. You know, it's like, well, you know, I'm very social, so I go out a lot, and you know, all of my friends smoke, and it's really hard if I'm trying to quit by myself. And then I travel a lot for work and this and that.
Are they going to Virginia because you can't smoke in the bars?
Well, there are definitely bars that don't. You can't. Yeah, you can't smoke in the bars in DC anymore. But we know from our health and outreach coordinator, Rihanna. It goes really hard for our smoking initiative, and you know, when she sees one of our smokeless ads, she like screams and gets excited and takes pictures. Or if we go out and she sees that people are smoking, she like, I'm gonna report them, and she like writes down, you know. And these are things that people should do, and people are not doing them because it is illegal to smoke in the bars or to have you know, people smoking in DC.
Yeah.
So you know, that's a violation.
Smoking so, and